Welcome back to TV5 News at 9. Joining us this morning is Carmel Roberts, practice administrator with Valley OBGYN. Thank you so much for being here. How are you this morning, Carmel?
Good morning, Colette. I'm well. How are you?
I'm doing great. Thank you so much. It's great to see you. Today we're talking about cervical cancer screenings, and we all know that early detection really is key to beating and fighting cancer. So let's start off with Carmel. What is cervical cancer, and is it common?
Well, cervical cancer is, like many other cancers, it really is at the presence of abnormal cells, or it happens and occurs when, in this case, when the cells that line your cervical area begin to grow or divide abnormally. It is fairly common, but there are a lot of risk factors that are very individual based on genetics and lifestyle that can place you more at risk for developing cervical cancer over your lifetime.
Let's dig into that one, Carmel, because that's a question a lot of people always ask. Is cervical cancer hereditary?
Cervical cancer is something, if you have had anyone on your mother's side who has had cervical cancer, your sister, your grandmother, aunt, that type of thing, then you are absolutely going to be at higher risk. There are a lot of other risk factors for cervical cancer, in particular lifestyle and genetics do play a role in just most all cancers. But really, we are looking at managing it through whatever the particular risk that patient presents to us. There are guidelines for the frequency and at what age you should be tested, and whether or not we're going to test with a PAP or a PAP smear, or we're going to test HPV or co-test with both. At Valley, because it is so individual and it is risk-driven, all of our 12 providers, this is something that they really take a lot of time to look at your background, your risk profile, including your family history, as well as your past tests. And we're going to tailor whatever our treatment and the frequency that we feel like we need to test you based on all of those factors to make sure that we can detect it early. It's important to note that cervical cancers, like a lot of other cancers that affect women in particular, ovarian, endometrial, in some cases breast, you really feel good. They are silent killers. Really, that's what they have a reputation for, because if you're not testing regularly and you're not looking for the right things based on a risk profile, then you might not catch it until it's too late.
Yeah, and Carmel, like you said, it's called a silent killer. So diagnosing this type of cancer early often allows for more treatment options. So how often do you recommend women be checked for cervical cancer? Get a pap smear and those other type of tests that you said that's tailored to that woman.
Absolutely. Yeah, knowledge is power, right?
Yes, that's right.
As I mentioned, the frequency that you're going to be tested is based on age and your risk factors. There are general guidelines. This is probably one of the most confusing to patients because the guidelines change, or they're not as black and white. Generally speaking, from 21 to 25, we're going to use, unless you have risk factors or an abnormal test. So this is just general guidelines. If you have no risk and no abnormal test, we're going to use a PAP. From 25 to 29, we're gonna take a look at your risk factors and either test PAP and HPV. And after that, 30 to 65, really, we're going to test PAP, HPV every 3 years, 3 to 5 years. Again, depending on your risk factors or what your previous tests have told us.
So women really need to keep abreast of this information and keep talking with their doctors. You know, Carmel, many women take the stance that, hey, I feel okay as long as they feel all right, that there's really not a problem. So why is it so important to be proactive and schedule their well women exams?
They do. It's so easy to do. You get busy.
You do.
And it's you put it on the back burner. I'm guilty of that myself.
Yes.
At times. It's important, as I mentioned before, because the cancers that affect women, breast, cervical, endometrial, ovarian, they develop slowly over time without symptoms. So if you're not checking for it, you can find yourself at later stages of it by the time you do start to show symptoms. It's important. I think when you have your when you're done having kids, or after the OB part of our care is over, at your postpartum we do a PAP and pelvic, and so we're going to test for your PAP and your HPV then. But then we want to see you. We want to continue to see you after that. We screen all of our annual exams in our new patients. We have a partnership with Myriad Genetic Labs. They are the gold standard in genetic testing. 35 genes have been positively identified as playing an inherited role in 8 of the most common cancers, including ovarian, colorectal, breast, endometrial. So we're going to screen first and foremost to see if you have any of those inherited risk factors, and then based on that, we're going to strongly recommend that you undergo that inherited cancer carrier screening, because it will tell us whether or not you have those genetic mutations that place you at higher risk. And based on that, as I said before, we're going to tailor your follow-up and your care and your management based on whatever that risk tells us. Right. So that we are putting that knowledge in your hands, and our patients can better take control of that risk and their health in general. Right. So we want to see you every year.
I love that. And every female is different, so that's not just one template for everyone. That's why it's very comprehensive.
It's not one size fits all.
No, it's definitely not. Well, thank you so much for this valuable information. Anything else that you just want to reiterate to let people know how important it is to go in and to see your doctor, or anything that we haven't talked about you'd like to add, just to put a exclamation point on what you're saying?
Statistically, 1 in 8 women at some point in their lifetime will be diagnosed with some form of cancer. And I think in today's day and age, it is that routine screening and working with us to utilize all of the latest and the innovative tools that we have to screen, and to make sure that we catch it before it starts, if we can. That's the best case scenario, or catch it early if it's going to start at all.
Carmel, I love that. And I just want to reiterate too, it is a silent killer, like Carmel was saying. We get busy with our kids, doing everything for our families and our loved ones, but we have to make sure that we take care of ourselves as well. Thank you for that information, Carmel. I appreciate you stopping in today. Thank you so much.
Thank you so much, Colette. Always a pleasure.
You are welcome. If you would like any more information about this topic, head on over to the hot link section of WNEM.com.